My name is Ryan Parker. I'm the Chief Legal Product Officer at SixFifty. And with me today on our webinar is Marie Coolbeth, who is our General Counsel and a key member of our legal product team. For those of you that haven't joined one of our webinars before, I'll give you a little background on SixFifty, and then I'll formally introduce Marie. But we are at SixFifty the legal technology subsidiary of the law firm Wilson Sonsini. Wilson Sonsini is one of the best law firms in the world, and they have helped many of the most famous tech companies to go public and with a number of their legal needs. And what we do with them is we work with the attorneys at Wilson Sonsini to take their expertise and use technology to make it more accessible, both for businesses and for individuals. We have a number of privacy products and also products that are helping businesses to return to work safely or return to their work site safely, create employee handbooks, and handle a number of different employment-related needs. And so today we're going to talk about the Delta variant and what it means for your workforce now and in the future. We are helping hundreds of businesses with the return to their work sites, and that has given us some unique perspectives on the challenges that businesses are facing and the way that the changes that we've recently seen in the spread of the Delta variant and the CDC's guidance are affecting and are likely to affect businesses. And I'm really grateful today to have Marie Coolbeth as my co-host. Marie graduated from one of the best law schools in the country and clerked for a federal judge. She, as I said, is our general counsel. And so she handles all of these types of return to worksite issues for our business and really is very thoughtful and has a lot of interesting insights in this area. Let me jump into our agenda, and I'll just give you a preview of what we're going to cover. Our introduction is almost over, and then Marie will talk to us about the Delta variant and what we've learned about the Delta variant, and so give you some interesting facts there about the Delta variant. Then I'll talk about the new CDC guidelines for fully vaccinated individuals that came out just 2 days ago and have really changed the landscape around the masks and many of the issues that businesses are facing as they contemplate returning to their work sites. Marie will then talk to us a little about health screeners. That's an area that she covers for our business and is one that is receiving more publicity. Then we'll talk about how states and localities are reacting both to the spread of the Delta variant and to the CDC's new guidance. We'll talk for a few minutes about what's next, and then we've saved some time for Q&A. Typically on our return to worksite related webinars, we've had a lot of questions and we want to make sure we have time to answer those questions. We would ask that you put those questions use the Q&A function at the bottom of your screen instead of putting them in the chat so that we can make sure that we're hitting all your questions and we can answer them and monitor them. If we don't have time to answer your questions, we'll try to answer them after the webinar, but we'd appreciate it if you put your questions in the Q&A, and we may try to answer them as we go so this could be a little bit more interactive, but we always appreciate good questions. So with that, I'd like to turn the time over to Marie to talk to us about the Delta variant. It's something that's been, I think, on the minds of many Americans and especially business leaders.
Thanks, Ryan. So today, as we dive in, we thought we'd give everybody a little bit of background on what exactly the Delta variant is and why it's having an impact and leading to some changes in some of the guidance we're seeing from the CDC and other government offices. So first off, we just wanted to talk a little bit about what it is. It's a specific strain of COVID-19 that was first identified in India last year in December. It then started to spread. And one of the first places you might have heard about it spreading to was Great Britain because it quickly became the dominant COVID strain there. It was first identified in the United States in March of this year, and it has grown fairly quickly in terms of becoming the dominant strain in the US as well. So as of the end of this month of July, 80% of cases being identified in the United States were from the Delta variant. One of the things that we're going to talk a little bit about today, as we sort of cover like new guidance, how does that impact previous guidance for people specifically who are vaccinated versus unvaccinated? Something to keep in mind with the Delta strain is that unvaccinated people and children and young people have been identified as the at-risk groups with the Delta variant. Part of that is because of how vaccines impact, whether or not you get COVID and the degree of like how bad of a case you might get. But we'll talk about that a little bit more. One of the most important things to keep in mind is that in describing the Delta strain, the World Health Organization has called it the fastest and fittest of the strains, which means it's the best at replicating itself so far, which is why it's growing as much as it is. It's also been identified as a variant of concern by both the WHO and the CDC. So, a lot of people are asking, what does that mean in terms of, how it might impact me? So if we go to the next slide here, I'll just sort of hit a few key points. One of them is that one of the reasons that Delta strain is more contagious is because they're finding that there are 1,000 times more copies of the virus in the respiratory tract of people who've been infected with the Delta variant than they find of people who've been infected with the original strain or the Alpha strain of COVID. So having more of that in your respiratory tract means that when you're speaking, when you're, coughing and all those other things, the likelihood that you're expressing virus that could come into contact with others and then be inhaled by them is higher. So it's more contagious for that reason. We're seeing also differences in the incubation period. On average, we see that people are infectious potentially on day 4 with the Delta variant, whereas it was day 6 with the original strain. So there's a period of time even earlier where you may not have identified that somebody has been become infected with the Delta variant, where they're transmitting it to other people. And then also we've sort of gotten used to identifying certain COVID symptoms, and it helps you really know. It's like, if I lose my sense of taste, I have COVID. That's definitely a COVID symptom. But the sense of taste, the loss of that has been less of an indicator of the Delta strain. What we're seeing more common as an indicator of Delta strain is headache, sore throat, runny nose, fever. And so, a lot of people have sort of, we've been living with the pandemic for a while. More people are becoming vaccinated. And so if you're exhibiting those symptoms, people are starting to treat that more as like, well, maybe it's my allergies, maybe it's a cold, it's probably not COVID. But that is in fact, those are the most likely symptoms with what's now the most dominant strain of COVID. So we need to readjust our thinking there in a lot of situations. So I just wanted to give you some information, just so that you know, the scientific information that was on these last 2 slides came from the Yale School of Medicine, from the CDC, and from the WHO. And with that, we're also going to show now some slides showing information from the CDC tracking the Delta variant. One thing to keep in mind is that it is moving more quickly. So we're seeing that people are able to infect. Typically it was on average 2.5 people per person. Like if you're infected, you might then infect 2.5 people on average. With the Delta variant, you're more likely to infect 3.5 to 4 people, meaning that it's spreading 2 to 3 times faster than the original strain of COVID. And you can see that in this chart that we have up on the screen now. If you look to the left side, which shows April, you'll see that the dark orange bar, which is the Delta variant bar, was very small in April. And then as you move towards the right on the graph, you see that the dark orange bar grows until we see, the 17th of July, we're seeing, 80% of cases are Delta variant cases in the US. So you can see just how quickly that variant has become the dominant one in the United States. And then if you're interested in how that looks regionally, we can look at this next chart, which shows you by region. Again, the dark orange is the Delta variant as a proportion of cases in those different regions. And you can see particularly in the Midwest and West that it's really become by and far the dominant strain in those areas. We're also seeing it gaining, the majority of ground in the South as well. If you're interested in your specific states, you can go, we're sending out these slides later, and you can see that link is on there for the tracker. You can go to that same website and you can drill down on a state by state level to see your local information. We are pretty much in a situation where, as we look at, what does that Delta variant mean for my business, this information can be very helpful one of the things that we're seeing our customers need to do is communicate this information to their employees. There's been a lot of information coming out during COVID. It changes because we get new data. It changes as we see the situation changing in specific localities. So there's been a lot of information come from a lot of different sources. So we have found that for employees, being able to look to their employer as a source of information is particularly helpful, because you're somebody they have a trusted relationship with. You're able to bring them, information relevant to them. If you drill down and look at it on the locations that you're based in as a company. So that can be really helpful for your employees. And I also just wanted to explain, we're seeing an increase, not just in cases, but also in hospitalizations. So our 7-day average for hospitalizations due to COVID in the United States has increased by 32% just the last 7 days. We're also seeing an increase in COVID deaths. So our 7-day average has increased by 9.3%. The majority of deaths from COVID at this time are in unvaccinated individuals. However, again, like, we don't want people to walk away thinking like, if I'm vaccinated, I don't have to change any behaviors. As Ryan will discuss in a minute, we have new guidance from the CDC because of the increased, sorry, I lost my word, the higher number of viral loads that we're seeing in people with the Delta variant, whether they're vaccinated or unvaccinated, means that we are going to need to see some changed behaviors in order to get it back under control, or under control for the first time, maybe is what I should say. And I did see there was a question in the Q&A about how the Delta variant is impacting children. It's a great question. We are seeing children at a higher risk, specifically because, and maybe we can move to the next slide because I'm going to start talking about vaccinations as part of this answer. We do see that people who've been vaccinated are less likely to get COVID, first of all, and that includes the Delta variant. However, if they do get COVID, if somebody has a breakthrough case who was vaccinated, the case is likely to be milder, so they're less likely, for example, to need to be hospitalized. And we do have data that shows that the vaccines, they do appear to be more effective against the original strain of COVID, but they are still extremely effective against the Delta strain. So for example, we saw a 96% effective rate against COVID-19 hospitalizations in the original Pfizer studies. What we're seeing now is a recent study is showing 88% effectiveness against the Delta variant for Pfizer. And that's against getting it, but we still see a 93.7% effectiveness against hospitalizations. So again, like, your risk of hospitalization is much lower, even if you do get it, if you've been vaccinated. But again, going back to the children question, children have not been approved for vaccinations if they're under the age of 12. So children are therefore at a higher risk at this time, particularly because the Delta variant is moving quickly. And because what we are also seeing, and what Ryan's going to talk about in a minute, the reason for the new CDC guidelines is that, well, originally it looked like people who are vaccinated were less likely to be able to transmit COVID. The new numbers, the new studies show that doesn't appear to actually be the case. You could have a breakthrough case of COVID as a vaccinated person and be transmitting it and have similar viral loads to what we're seeing in unvaccinated people. So, if you've been vaccinated, you might feel healthy, because if you do get COVID, again, you may be asymptomatic completely, or you may have, very light symptoms, but you might be walking around transmitting the virus to unvaccinated individuals around you, which includes particularly children as an at-risk group. So keeping that in mind, we're going to talk today about, the changing legal guidelines and the changing CDC guidance and what that might mean for you as an employer. One thing that I, as an employer, am taking into account is, I have to protect my employees. I have to protect visitors to my business, but I also have to think about, the people that my employees are around. their families, the people that they live with, the people that they spend their time with. So, are the things that we're doing protecting their community, the community that my employees are a part of?
And I'll say, just as a 650 employee, that we appreciate Marie's thoughtful approach, because it's not an easy area. We're going to transition now to the CDC's updated guidance. And as Marie mentioned multiple times and showed, I think, powerfully with different graphs and figures, the Delta variant has really sort of changed the calculus, the risk calculus for Americans and for employers. If you remember back in May of 2021, the CDC came out with new guidance for fully vaccinated individuals, essentially telling people that they did not, if they were fully vaccinated, meaning that they had received the second dose of a 2-dose vaccine or the first dose of a 1-dose vaccine, and at least 2 weeks had passed since they received their last dose, that they did not have to wear a mask indoors or outdoors around vaccinated or around unvaccinated people. Essentially, the CDC said at that point that people who were vaccinated could resume doing the things that they had done previously, for the most part, without having to wear a mask. And that was the guidance until 2 days ago, on June 27th, 2021. And in light of the way that the Delta variant has spread and some of the breakthrough cases, and especially the numbers that many of our states and counties have seen of COVID cases, the CDC came out with new guidance. And I've broken it into 3 parts. The part that has received the most publicity is this first part that says that fully vaccinated individuals should, and I quote, wear a mask indoors in public if you are in an area of substantial or high transmission. And that's a big change from the guidance that the CDC put out in May. Essentially now, if you are in an area of substantial or high transmission, you should be wearing a mask even indoors if you're in a public place. That doesn't mean necessarily that you have to wear a mask in your house, but when we talk about employers, if you have people coming to your office, that's a public indoor space and people should be wearing a mask. The question that we have gotten so far is, well, how do you know if you're in an area of substantial or high transmission? And the CDC has provided an online tool for determining whether you're in an area like that. And we're going to provide these slides to you after the webinar, and I provided a hyperlink on this slide. But you can go to the CDC's website and they give you this tool that will help you to see if your county is an area of substantial or high transmission. I created this graph using the tool yesterday to just give you a general idea of what the United States looks like. According to the Washington Post, more than 33% of US counties fall into the categories of substantial or high transmission, and that would trigger that mask recommendation. And as you can see, actually, I found this map to be very interesting. There are certainly some pockets that have almost all of their counties as high. Marie is from Louisiana, and I noticed, I think there may be one county, but a lot of the counties in the South and in the Midwest are very, very red, whereas some of our counties in the Northeast are yellow, and then we have a mix in the West.
Yeah, we're all red, and we call them parishes in Louisiana, Ryan.
I should have, we talked about this. I should have known that we were talking about the parishes in Louisiana.
Yeah,
thank you, Marie.
But it is a cause for concern, right? Because we're part of multiple communities.
And so this is, I think, an interesting graphic and a tool that you can use as a business to determine whether you're in a high or substantial transmission area, and whether that recommendation for the CDC that individuals, even who are fully vaccinated, continue to wear masks in public indoor places applies to your business. This map, I think, is dynamic and will change over time. As you can see, this is based on a time period from July 19th to July 25th. And as the map changes, obviously that also affects the guidance. I think that puts businesses in a difficult spot. It's a little bit easier to have a cut and dry rule that's going to stay in place for a long time. It could be that many of these counties stay red or orange for an extended period of time, but we could see some movement. If people start putting on their masks and are more careful, I think we could see counties moving from, for example, substantial to moderate, where that recommendation is not in place. I think it also leaves businesses with an interesting question about whether they just want to continue to require masks in public indoor places for the foreseeable future, why we try to weather this difficult storm that's caused by the Delta variant. I also think it's interesting for businesses that have offices in different locations. I'm from Maryland, where our state is primarily yellow. Many of my colleagues are in Utah or in California, where there are mixes. And so for companies that have multiple locations, determining how they're going to implement the CDC guidance, I think, can be a challenge. Let's turn for a minute to the second part of the guidance that I thought was interesting. The CDC, I think, also really wanted to make sure that people understood that even if they're in areas of low transmission or moderate transmission, that individuals who are potentially more likely to suffer from a serious case of COVID-19 or who take care of someone who may be in that situation should feel free to wear a mask. The other thing that's interesting here is this guidance that they gave about close contacts. This has been an issue that businesses have wrestled with for a long time. It was a little bit easier initially with health screening to determine who needed to stay out of the office if they had COVID or had COVID symptoms. If they had tested positive, that was pretty straightforward. But the CDC has been very clear that one of the ways that we could keep COVID from spreading is having individuals quarantine if they have had close contact with someone with COVID-19. And close contact is defined by the CDC as being within 6 feet of someone who has COVID-19 for a total of 15 minutes or more over a 24-hour period. So it doesn't mean you cross them in the hall, but it does mean if you sat in a meeting with them and were closer than 6 feet for more than 15 minutes, that's a close contact, or if you visited with someone. And so the old guidance in May essentially said that if you were fully vaccinated and you had close contact, you didn't need to quarantine and you didn't need to be tested. The new guidance, interestingly, says that if you're fully vaccinated and you have a close contact, you should go and get tested 3 to 5 days after your exposure, even if you don't have symptoms. And this is a significant change. And you should also wear a mask indoors in public for 14 days following exposure or until your test result is negative, which is interesting. They're not saying that if you're vaccinated, you need to quarantine after you've been in close contact, but they are saying that you need to get tested 3 to 5 days later and that you should be wearing a mask in public indoor spaces until you get your test results. And that's a significant change. We work with a lot of companies on health screeners, and I think this is something that we're working with companies to figure out how best to implement this change in the close contact rules. I also found this interesting because I think the news media was so caught up on the mask change that this is one that has not gotten a lot of attention, I think is significant. Finally, I thought these two things were interesting, and I think this is important. We'll move to part 3 here, is that the CDC recommended universal indoor masking for all teachers, staff, students, and visitors to schools, regardless of vaccination status. And I actually felt like this part of the guidance will affect businesses because the school situation that we've had where students have been learning from home and in some situations or have been in hybrid school environments has significantly affected the workforce of many companies. And I think it's interesting that the CDC's made this recommendation, especially because there are a number of states that have already come out and told schools that they can't mandate masks. And I think this is going to be a hot button issue in the coming month as students prepare to go back to school and as working parents prepare to send their students back to school, whether schools will require masks, whether students will be wearing masks. And I think that will affect businesses as parents are trying to figure out how best to navigate their parental responsibilities and their work responsibilities. And then finally, this is the point that I touched on earlier. The CDC noted that if you live in a household with people who are particularly vulnerable, you may want to continue wearing a mask in public indoor spaces. And I think this goes back to our question that we had earlier. One of the vulnerable groups that is identified by the CDC is the not fully vaccinated. And so if you have children under the age of 12 who are not yet eligible to be vaccinated, they fall within this vulnerable group. And so the CDC's recommendation is at least that people consider continuing to wear a mask in public indoor places if they are at a higher risk of severe illness, or they are around people that are at a higher risk of severe illness, or they have people who are at an increased risk of getting the COVID-19, which includes children. So I thought that was interesting guidance from the CDC as we're looking at this. Marie and I, as I said, work with a lot of different businesses on helping them with their return to work plans. And it's been interesting as mask mandates have been removed in a number of different states or softened in some states, even including California. We've received questions repeatedly about whether employees should be allowed to continue to wear masks if they're vaccinated. And I think as a best practice, it's very important for businesses to allow individuals to do what they're comfortable with in the workplace. And that includes wearing a mask, even when it's not required or when you think that it would be required, because you may not know if they're coming in contact with someone who is at a higher risk of severe illness, or if they have children at home who have not been vaccinated. And I think normalizing the wearing of masks is also important and interesting that the CDC put that out as part of their guidance. These are kind of the three major parts of the CDC's guidance. I think that we'll see some follow-up guidance around the edges, but it will be interesting to see how these are implemented. And we'll get a little later to how states and localities have responded. It's only been a matter of days, and I think that we're likely to see a lot more. But this guidance is significant in that it's a large departure from what the CDC put out in May, only a few months ago. And I think that shows the severity of the situation that we're in and the importance of following this guidance. In addition to, we've talked a lot about masks. Another issue that we get a lot of questions about is health screening. And I'm going to turn the time over to Marie to talk a little about what she's seeing in the area of health screening.
Thanks, Ryan. I think we wanted to highlight health screening for you today because even though it was not highlighted in the new CDC guidance, the reasons for conducting health screeners are really in line with the reasons that we mask. It's about prevention, it's about protection, and it's also, and this is a difference, it's also about being able to figure out who might have been a close contact if you're doing a health screener as an employer. So I just thought I'd spend a few minutes talking through what I've been looking at. So we are seeing, most states have relaxed their health screening requirements. California hasn't. California does still have a daily health screener requirement if you have employees who are coming in to the work site. And the new CDC guidance doesn't specifically say that you do need to reinstitute health screeners if you've relaxed them. But I think we're going to see, the need for them increase. The Delta variant is on the rise. And I am thinking about, the situation at my own work site. When the guidance came out that said essentially, if you're vaccinated, then you don't need to worry about quarantine. You don't need to worry about going and getting tested if you've had close contact with somebody. We came to the conclusion after analyzing a lot of things at our company that if somebody submitted proof of vaccination and that it had been the full 2 weeks since their final shot, that we would allow them to come into the worksite without filling out a daily health screener. So the last message that they received from our health screener system told them, okay, you don't have to fill this out every day anymore, but if you do have any symptoms, do not come in. But it's been a few months since a lot of people received that message because they've been some people have been vaccinated for a while now. And so as we're thinking about, okay, things are changing, the Delta variant is on the rise, we're going to have more breakthrough cases, not because the vaccine's not efficacious, but because, the percent of the population that may have a breakthrough case represents a larger and larger number the more people are vaccinated, right? So we have some people that may be coming in with that stuffy nose because they've kind of forgotten, they haven't been in the practice every day of filling out that health screener and have something remind them, we don't want you here if you're experiencing any symptoms. So that's one of the reasons to think about reinstituting it. And your vaccinated employees, as we've mentioned previously, can still get COVID. And, if somebody comes into the work site, whether they're vaccinated or unvaccinated, and then gets a positive COVID result, you need to be able to track who they came into contact with while they were at the work site. And, interviewing people, asking them who they saw can get you so far, But if somebody else was in the building and they space that, they don't remember that they saw that person, if you've got a list, you can check and be like, well, did you spend any time with so-and-so? Did you spend any time with so-and-so? When you do your worksite investigation, to make sure that you're letting any of your employees who may now be at risk and may now need to go get tested, give them that information so that they can go take appropriate protective measures. So that's one of the main reasons that I'm considering changing my previous policy. I've already started testing how that would work and what I would need to do differently. So those are some of the concerns to take into account. And I think it really does come back to what Ryan was talking about a minute ago when he was talking about sort of the second part of the new CDC guidance, which is, if you've been around somebody who has COVID-19, you do need to now go get tested, even if you're vaccinated. That's new. That's a big change. And so I need to be able to know which of my employees were here if somebody who comes in then comes down with COVID. So for me, that's a big part of the consideration for reinstituting health screeners if you've relaxed them for vaccinated individuals. And I did see a question that was in the Q&A kind of along these lines, which now the Q&A box disappeared from my screen. There it is. Okay. Where someone was asking whether if your business is not open to the public, if you still need to, put these new guidelines into place, whether it's masking or other parts of the guidelines. So say my company doesn't allow visitors, so only employees can come in. If those employees are all vaccinated, do we still need to follow these new guidelines? My answer would be yes. That's a very nuanced question. And right now the CDC guidance doesn't go to that level of nuance. And since it doesn't, out of an abundance of caution and to protect everybody in the work site, I would say the answer is yes, because among other reasons, people may be asymptomatic who are breakthrough cases, and they could then give it to somebody else who's also vaccinated. I mean, 2 breakthrough cases in that small of a work site may be very unlikely, but it is possible. So somebody coming in who's asymptomatic, they're vaccinated, they're shedding virus. Somebody else who's vaccinated is also there. Neither of them are wearing masks. That other person could still get it from them. It's still possible. So again, from the abundance of caution perspective, I would say yes, even if everybody in that room is vaccinated, the new guidance is saying they should be wearing masks. Ryan, would you agree or disagree?
Yeah, I think that's actually a nice transition to our next slide. Let me just add on health screeners before we transition in, and I'll weigh in on that question because I think it's a really interesting one. That a lot of companies, I think, initially were worried that health screeners would be extremely burdensome. And as we have a health screener and we help companies to use it, it's really just a URL link that they put in a Slack channel or they put in a calendar, and employees can go through it in 30 seconds in the morning. And I think a lot of companies have gotten, and even when we stopped, a lot of people were in the habit of just doing that as part of their morning routine, taking those 30 to 45 seconds, filling out their health screener. And as companies have realized that isn't really that much of a burden to get people to they're already on their phone in the morning anyway, to click through their health screener on their phone before they jump in their car. I see a lot of benefits and not a lot of drawbacks to continuing on with health screening. But let's jump to the next slide. And I want to touch on that question because I think that's a really interesting one. One thing to emphasize about the CDC's guidance is that for most businesses, it's just guidance, right? It's guidance that comes from the CDC, and it's the states, counties, and localities that are actually making the rules around these issues. And many of them are taking their cue from the CDC and they're following the CDC's guidance, but some are not. And I think it's interesting to look and to think about the fact that, and I think this is a challenge for businesses, that on a federal level, we have the CDC issuing this kind of guidance, but it's really on the state and local level that guidance is being put into place as mandatory or not in many cases. And so I do think as you're looking at this, there are some decision points for a business, and I'll use California as an example. I know our questioner said that she worked at a tech company. In California, the Cal OSHA rules were recently changed, and they allow individuals who are fully vaccinated and have documented their vaccination status with their employer not to wear a mask. And the employer can come up with their own policy, but that's a permissible policy. And so I think there are a lot of employers in California, based on the new Cal OSHA regulations, who are allowing individuals who are fully vaccinated not to wear masks, which actually right now is inconsistent with the CDC's guidelines. The California Department of Public Health came out with a recommendation, not a requirement, that people follow the CDC's guidelines. And so where does that leave a California business? Well, the requirements are that it meet Cal OSHA's emergency temporary standards, and then it can choose whether it wants to take the additional step of meeting the CDC's recommendations. And so I do think there's a choice there. I would say that I agree with Marie that as a best practice, I think it's worthwhile to be cautious with your employees, excuse me. I do think there's a gray space, and sorry, Marie, I'll just finish this one area, for workplaces that are only allowing vaccinated individuals into their workplace. I don't think that's directly addressed by the CDC's guidance. I think that differentiation, when it says public indoor space, I'm not sure that that's contemplating a workplace where only vaccinated individuals are allowed to come in, or where unvaccinated individuals are, wearing masks or the like. I think it's an interesting question, and I would assume that we'll get maybe some clarification on that issue, because I do think that's a gray area that I see from the CDC's guidance. Sorry, Marie.
Oh, I was just going to say, and I would add that I failed to put a level of nuance on my answer that I should have, which is I was answering as if that tech company were in an area of high transmission.
Yeah.
Right. Because the new guidance is regarding, places that are in areas of high transmission. So if I were hanging out with Ryan in his area of Maryland, where they're not in a high transmission area, and that's where my tech company was located, I would have had a different answer.
Yeah, great point, Marie. It's been interesting to see how state and local governments have responded to the pandemic. That's something that we track as a company. We provide updates to our customers to help them. And so this is something that we watch very closely. And we have a number of state and local governments that have been very proactive. And in this case, it was interesting. On July 18th, about a week before the CDC came out with its guidance, almost a week, Los Angeles County reinstated its mask mandate, requiring individuals to wear masks indoors in public places, regardless of their vaccination status. And they saw what was happening in Los Angeles and their numbers, and realized that they needed to take action, and they didn't wait for the CDC. If you've been following, there's a little bit of a soap opera going on, and the sheriff of Los Angeles County then said he wasn't going to enforce the mandate. And so there's been a little back and forth. Unfortunately, this issue has been highly politicized, but it was interesting to see Los Angeles County, which is the most populous county in the United States, put their mask mandate back in place before the CDC even changed their guidelines. We're now waiting to see what dominoes will fall after the CDC has updated its guidelines. And we've had a couple of very quick movers. Nevada came out and said, okay, we're going to incorporate a mask mandate that follows the CDC's guidelines. That mandate will cover 12 of Nevada's 16 counties based on whether they're in substantial or high transmission areas. And that includes Clark County, the home of Las Vegas, the largest city. Yolo County, California, St. Louis County, Missouri, and the city of St. Louis also issued similar mask mandates incorporating the CDC's guidance. And a lot of other localities are taking action. Our business is based in Utah. I know Salt Lake County came out and said that in county buildings, they were following the CDC's mask mandate. And I think you're going to see a lot of localities now that are weighing how best to incorporate the CDC guidance. And to be honest, I think it's a very difficult question for those states and localities, because in some sense, their businesses are getting a little bit of whiplash. And this is a very dynamic situation. But on the other hand, a lot of these areas are being just ravaged by the Delta variant, and they're seeing hospitalizations skyrocketing. And there's the fear that we're going to have to close things down, maybe not to the same extent that they were closed down earlier. But I do think as businesses take proactive steps, that can help us to overcome sort of what we're facing. And so there are a lot of different factors for localities to consider. On the business front, I would say it is vitally important that you're watching your state and local guidance, because it's often, in many places, it's changing quickly, and you want to make sure that you're up to speed with what your state, county, city requirements are, so that you don't run into problems with regulation, and so that your employees realize that you're taking those requirements seriously and you're protecting them. And so this is really just the tip of the iceberg. These were the states and counties and cities that we saw that moved immediately. I think there are more, and I think that you're going to find a lot of changes over the coming weeks as states and localities adjust to this new CDC guidance. So I'd like to just chat about what's next, and then it looks like we have some really great questions in the Q&A, and we'll leave some time to make sure we hit those. And Marie, I'm interested in your thoughts on this. I think that we're going to have a lot of states and localities that are going to adopt the CDC's new guidelines in some form or another. What do you think about that? You think that's likely?
I think that is the most likely scenario right now, because everybody is seeing those pain points that you just described, Ryan. Hospitalizations are up in the areas with high transmission. Elective surgeries are once again being put off because they need the beds for other reasons. All of those things are going to lead states and localities to need to find ways to help decrease and flatten that curve again.
And I think, I think we'll see a lot of states and localities. I think we'll also see states and localities that decide they're not going to follow the CDC guidance. And that will be really an interesting issue to watch, who decides to make those changes and who doesn't. I think, you have states that have been very quick to follow the CDC's guidance. You have others who have been more skeptical. And then you have states like California that are, kind of like a cruise ship. It's a little bit hard to turn that ship one way or the other. Cal OSHA showed us that earlier when they tried to amend their ETS, had to pull it back, put new ones out. And so for a lot of these states and localities, it's difficult to make changes, and it may take some time, but I think we'll see a lot of changes in the coming weeks.
Yeah, and I do think we'll also see, speaking of the fact that some will be slower to respond or may not respond in the same way, we do have some states that currently have rules in place that go directly against the CDC guidance. So, the states, for example, of Texas and Arkansas have issued bans saying that schools cannot require masks. And so, that ban would first need to be lifted before a rule could be put in place that would allow them to follow, for example, the rule the guidance regarding schools having everybody be masked.
Yeah, it's a great point. I mean, one of the real challenges for businesses, especially businesses that have multiple offices, is just how much the state and local rules vary from one location to another. And I think we're going to continue to see that. And that divide may widen with this round of CDC guidance, I think. The next one that I put on here is that more employers are likely to require vaccinations to return to the work site. And I actually created these slides yesterday. And after I created them, I saw that Google and Facebook have both announced that they're going to require their employees to be vaccinated before they return to the work site. And this is, I think, a significant change. We've been helping companies to collect vaccination information and to create vaccination policies for several months now. And initially, most of the companies that we surveyed in webinars and that we helped were looking at policies to encourage but not require vaccinations. And I think we're going to see a shift as more and more companies move to requiring vaccinations, just because as a company, I think they want to make sure that they're protecting their employees and they're protecting their company. What do you think on that, Marie? You think we'll see more of that?
I think we will. And I think this also touches on a question that came into the Q&A where they're asking, given the information about viral loads in vaccinated and unvaccinated people, does that change the efficacy of mandatory vaccination programs or mandatory vaccination policies? And then we've already been talking about the need to have people masking all the time. And so I think the answer is it doesn't change the need for vaccinations at the community level, because it's not until I've seen different numbers. One of the epidemiologists we consulted before the webinar said at least 85% of the population needs to be vaccinated for us to really see COVID start to come to an end. So we still need vaccinations. Um, and I think we're going to see more companies start to follow in the footsteps of your Facebooks. One of the reasons being that we're now in a different place in the pandemic and in the rollout of vaccines. Earlier, even if you were considering a mandatory vaccination policy, you really couldn't put one in place because we didn't have enough vaccines. And we're no longer in that situation. Now we're in a situation where if companies want to implement a mandatory policy and fulfill it by actually offering the vaccine, they could potentially do that because now there is enough vaccine availability and we don't need to worry about the distributive justice impacts within the United States of there being communities that don't have that ability to access the vaccine because our company is requiring everybody to get it.
Yeah, I think that's a great point. I had a sub point here, and I think that President Biden was going to have a press conference this afternoon to talk about potentially putting a mandate in place for federal employees. And that may be something also that causes companies to follow the lead of Google and Facebook. We talked already about health screeners. I think we can move over that one because we covered it. But I think it's interesting. There was a lot of moaning and groaning among companies, I think, when they were required to do health screeners. But I think they may be here to stay for a while with this emergence of the Delta variant. And I think there are a lot of benefits. And finally, the last one that I think is almost a surety is that we're going to see more changes in federal, state, local COVID guidance. I think there are several more twists and turns to this pandemic left for businesses. And I know that's not what people want to hear. I think that after the CDC's May guidance, a lot of individuals, including myself, hoped that we were sort of on our way out of the pandemic, but I don't think that's the case. And I think we're going to have to continue to be vigilant, and we're going to see changes in the federal guidance. We're going to see changes in the state and local rules that continue to come. The other thing is we're going to learn more about how long the vaccine is effective and what booster shots look like and what variants are out there. And I think COVID-19 is probably here to stay for quite a while, and businesses are going to need to really be thoughtful, I think, about putting in policies and having policies that they can adjust and keep up to date as the landscape continues to change.
I think that's right. But I would add, in case that's sounding a little dire for anybody who's here today, we know how to do it. If you're at this webinar today, it's because your business is still open, which is great. But, we've come through the, part of the pandemic where we didn't know what we were doing. We didn't know how to handle quarantines. We didn't know how to handle mask mandates. None of us had masks. We've come to a place where we do know how to do these things. We just have to be quick and pay attention so that we can make sure we're taking the right steps at the right time.
Yeah, I think that's a nice optimistic note for us to move into questions. And I agree with you. I think we may have some fatigue at doing some of the things that we know we should be doing, but I think now is an important time to take the lessons that we've learned over the last 18 months and use them to kind of help us and what I hope will be, the last couple miles of this pandemic journey, at least until we can get things under control. So yeah, great point, Marie. Well, let's dive into some of these questions and we'll see if we can get through some of these. The first one I'm seeing is, are companies allowed to collect vaccination status information from third-party vendors or contractors? If so, are there any limitations, requirements beyond what is required for employees? I think that's a difficult question. And I do think, though, that if you have a policy of only allowing vaccinated individuals to come into your workplace, that you can have that policy for others as well. I think you're right, though, to flag that you need to keep that information confidential. Under the Americans with Disabilities Act, vaccination status is health information, so it cannot be put in a personnel file and it needs to be kept confidential. I think as a best practice, companies also are being very careful about the documentation that they create. There may not be any reason to, for example, take a picture of their vaccination card or create more documents that you have to store and be careful about. But I think my view is that you can require individuals who come into your workplace to be vaccinated if that's a step that you feel you need to protect your employees.
Yeah, I would agree with that. And I would second the part about documentation. Doing a verification, whether that's by looking at their vaccination card or a picture of their vaccination card or their their pass, if you're in a state like New York, where you have an actual digital version that you can look at, verify it, but you don't really need to document it in a way that you then have to worry about what is my data retention policy about this card that I now have a copy of.
Yeah. The next question, do you see an increase in employers wanting to conduct rapid tests or to require tests for employees on a periodic basis? And I would say the answer to that is yes. I recently talked to a bunch of venture capitalist firms that were talking about how they were trying to bring their employees back. They wanted people back in the office, and rapid tests were a big part of their plan, even though they weren't required in the locality where they had offices. And a lot of them were going to have individuals who were not vaccinated continue to wear masks and take tests on a periodic basis. And even their vaccinated individuals take tests on, I think, a less frequent basis. But I do think rapid tests are a tool that companies can use. And I think, the price is going down, the availability is going up, and that's something that companies can think about. And I think as a trend, that is something that we're seeing.
I would agree. But I would also say it shouldn't be the only measure that you're taking, because alone it's not going to be sufficient to really make sure that you're, sort of checking all the boxes on the safety steps that you can take.
Yeah, and I think that's a good point. And actually, I'm going to jump down here to this question from Kurt Barton, who asked, any comments on the new California health order requiring healthcare settings to verify vaccination status, and if unvaccinated, require them to test once a week? I think that's an example of how governments are using testing as a tool, especially for the unvaccinated. And so I do think we're going to see that. I think that order is, in many ways, California has been a leader for a lot of states. And I think that we could see that order copied and expanded in other areas.
And I think we're also seeing a similar trend in the federal government. The VA is implementing a similar policy in that healthcare setting, where if you're not vaccinated, you're getting tested. And I think it might even be more than once a week. I don't completely remember now, but similar policy that we're seeing in other places as well.
Yeah. And I that's a great point, Marie. The place that we're seeing that the most, I think, is in healthcare settings, but I do think that we could start to see that spread into non-healthcare settings as well. We have an anonymous question here. What are your thoughts on guidelines for large-scale meetings and events? I think that's difficult at this point. I say that with some hesitation, because after the May announcement, I think a lot of companies thought, hey, we can get everyone together for some big different events. And based on the numbers and the spread that we're seeing of the Delta variant, I think that a lot of businesses are rethinking those plans. And, if steps can be taken to hold the event outside, and if you can have masking or other things, I think there are ways that can happen. But I think that we're living in a different environment than we were, in late May or June, after the CDC's initial change guidance came out with the Delta variant. And I would make sure that at least I would advise companies to really take precautions if they're going to hold large scale events.
And I would also suggest, like, if you're in an area of substantial or high transmission, that you really think carefully about it. Particularly not just, well, for two reasons, right? There's the reasons that we've been talking about, the health and safety of your employees, which is paramount, but also changing rules. If you're in an area of substantial or high transmission, it's more likely that you're going to see a changed rule that may come right when you're about to actually host that large event that you've just put a lot of resources into. And so if there's the chance that at the last minute you're not going to be able to hold it, and you've lost a lot of resources, it may not be worth it. So you may want to think about, what could we alternatively do that, like Ryan said, maybe you could move it outdoors, maybe you could do those things. But if there's the chance you're not going to be able to hold it at all, maybe you hold it somewhere else where the rates of transmission are lower, and you put a lot of sort of steps along the way for attendees to make sure that attendees are being safe before they come.
Yeah, Marie, that's a great point that you make, that it's important to know what the local guidance is, and you as a business really don't have any control over how that may change. Yeah, well put. I hadn't thought about that, but I think that's a key consideration. Let's hit a couple more of these in our last 4 minutes. Does the health screening require daily questionnaires? sorry, how else can we meet this requirement? For example, temperature screening at the door. Yeah, I think it depends on your state. There are states have a lot of different requirements. Many states have rolled back their daily health screener requirement. In California, businesses are required to have their employees screened. The employees can do it at home before they leave for the office, which I think is the best practice. No one wants to turn their employees away at the door. But you do have also some that are having them do a questionnaire at home and then taking temperatures when people get to the office. And so there are different ways that can be done. I think it can be on an online questionnaire is what we provide to our customers, and we customize that for them and work through that medium. But I think there are different ways that can be done. There's some question in California, particularly with Cal OSHA, about what the screening has to look like. But I think a best practice is to have your employees screen every day and to have a record of that screening. So as Marie said, if you have a positive test, you know who's coming to the office and you have the documentation you need.
Agreed.
This is another one that we touched on, it kind of related to large scale events. As an event planner, we're struggling with whether or not we can mandate vaccine proof for in-person attendees. And, that's a great question. And it likely depends on where you are. Some states have laws that don't allow you to keep out people who are not vaccinated. I also think that can be difficult just administratively as you think about that. The thing about the May CDC guidance is it sort of assumed that people would act responsibly, that those who were vaccinated, didn't need to wear a mask, and that unvaccinated people would wear masks. And at least I've seen some commentary that this change is sort of an acknowledgement that just that didn't work. And so I do think that this is a great question. And I think it's hard to know whether you can mandate vaccine proof. And I think what you'd need to do is check your state and local regulations. There are certainly some states where that would not be permitted. I believe Florida is one of those. But there are other states where that may be an option, and certainly it could protect those who attend.
I would also say it depends on what types of individuals you're planning events for. So if you're an event planner at a corporation and you're planning events for your employees, you're going to have a higher level of control than if you're trying to plan public events where the public is invited in. There you're going to definitely be paying a lot more attention to the local guidelines because they're more likely to impact. Whereas within the sphere of your organization, as we've already talked about, you have the right to ask your employees whether or not they're vaccinated. And so you can then make decisions about who can go to which events and things, as long as you're ensuring that you're not discriminating. So for example, mandatory vaccine policy, in order to come into the workplace, you have to also have a policy that allows somebody to submit an exemption based on a religious or medical reason. So, as long as you're, being careful about that, and you're planning events for employees, that's really different than if you're planning a large event where people are all going to come meet up in a park, right? And it's anybody in the public who wants to pay their $5 admission fee. That was a really cheap event.
Yeah. No, I think that's a fair nuance. So we're right up against our hour. I'm going to quickly give answers to these last two questions before we sign off. One is, if a vaccinated employee is exposed to COVID, are they required to test negative for COVID? Under the new guidance, the CDC guidance, if a vaccinated individual is exposed to COVID, they should get a test within 3 to 5 days, and they should wear a mask in public indoor spaces until they get a negative test result. That's the guidance. And so that is a big change. It's interesting. They don't say that they have to quarantine. I could see businesses asking people to quarantine, but that may not be necessary. I think the CDC is taking a cautious approach. I do think it's important, though, for you to look at your local guidelines. For example, Cal OSHA, hasn't been adjusted for this. And under Cal OSHA, a vaccinated employee who comes into close contact doesn't need to quarantine currently. And last, what do you feel about employee waivers, especially if they are attending a sales conference outside of our office? I'm not a big waiver fan. I know attorneys typically love waivers, but I think in a lot of these situations, waivers are not going to be considered voluntary, I guess, depending on the nature of the waiver. But I actually think that the best way for business to protect themselves is to take reasonable steps to make sure that their workplace is safe, and that waivers, I guess they can help around the edges, but I wouldn't rely on them as sort of the main protection for a business. With that, we've gone through a lot of questions. We've covered a lot of material. I want to thank everyone for joining us. If you have questions about the things that we've talked about today, or the way that we helped our customers to return to the worksite safely, or any of our pro bono tools or our privacy tools, feel free to visit us at SixFifty.com, and we hope we'll see you at a future webinar.
Thanks, everyone. Thanks, Ryan.
Thank you, Marie.